Channel 4's One Born Every Minute, television's image of a modern maternity ward, with pain, triumph and joy present in equal measure. But behind this image lies a very different truth, that Britain leads Europe in one very devastating statistic. 1 in 200 babies is stillborn, and despite medical advances in the past decade, this number has not decreased for 15 years. These shocking revelations have propelled us to find out why the stillbirth rate in the UK is so high and whether any research has been carried out to improve this. We've spoken to many women about their devastating stillbirth experiences, and one woman, Juliet, wanted to tell us about her story, but understandably did not want to speak on camera.
The first 2 trimesters of my pregnancy were beautifully straightforward, without even a whisper of morning sickness to mar them. We left the hospital after the 20-week scan, warm with the confidence that the next time we would be there would be for the birth of our baby.
By this time, Juliet's baby had stopped moving completely.
I knew the life inside me had died. It wasn't instinct, it was fact. What had moved and kicked and turned and lived had gradually slowed and stopped and died.
In our busy lives, it's easy to forget that tragedies like these occur every day. But we're going to travel the country to track down the leading experts in the field to get some answers. The UK stillbirth rate is currently 33rd worst out of 35 economically comparable countries. We've come to Cambridge to talk to Professor Gordon Smith, who has published much research on the topic.
About a third of all stillbirths in the UK, about 1,200 in the last report, the baby's born at term, that's from 37 weeks or beyond, and the vast majority without a congenital abnormality. And these are babies that we would feel, if they could be identified and delivered before they succumb, we would expect them to have a normal life thereafter. So there are a series of risk factors. The problem is that the vast majority of, well, it's estimated about 80% of stillbirths that occur aren't related to these factors. So if we use these factors and target our care just to the women who are obese or overweight or of advanced age, we'll actually miss an awful lot of stillbirths. The majority of women assessment of baby's growth is through measurement of the size of the bump using a tape measure, a thing we call the symphysis fundal height. And we do this despite the fact that we know that it's not a particularly accurate method.
Research in the West Midlands has led to a significant reduction of stillbirths in that region. So if the research is proving to be effective, why isn't it being applied to the rest of the United Kingdom?
There would never be a relaxing of the rules that we have to have in place prior to national implementation of a system of care. We have to have good quality evidence to support it, and I'm sure that evidence will be forthcoming, but it's just not out there at the moment.
But we found a research centre that does have proof. So we've just arrived at the Perinatal Institute in Birmingham to talk to Dr. Gardosi, who's leading the research which has led to the reduction of stillbirths in the West Midlands.
Yes, we had 53 fewer deaths, stillbirths, in the West Midlands last year, but there's much more that we can do. And if you translate this to potential lives saved across the whole of the NHS, it would be approximate to about 600. And remember, each one of these is a life lost, a catastrophe for the family, for everybody involved. And what we've shown is that with a concerted program in the region, we're able to effect this change, and it is something that has been proven, tested, and can be rolled out across the whole of the country. The reduction of stillbirths was associated with a comprehensive program that we implemented across the region, which included, first of all, raising awareness that many of these stillbirths are potentially avoidable, and were associated with instances where the baby did not grow. So then we implemented training programs to improve the antenatal detection of fetal growth restriction. And this was with better protocols and with the so-called customized growth charts.
One of the big parts of using customized growth charts is that everybody's using a standardized method. I think that's really important. It's standardized, so everybody's using the same technique to actually measure a fundal height measurement. They're plotting on an individual chart, so it's the mother's individual chart, so they're looking at her serial growth, and they're identifying those women that are low risk for having growth problems. So it generates an average line, which is the middle line, and then it generates upper and lower accepted ranges for her. So it's totally individual to the mother.
So it's more accurate.
So So it's a standardised way of doing it.
Yeah. A standardised format using a standardised technique and an individual chart for the mother.
For the DeCostas and Sevenoaks, it's time to reflect on everything that's happened. Their son Raphael stopped growing at 33 weeks, but this was not recognised by doctors until 6 weeks later, when his mother was forced to undergo an emergency C-section. Raphael spent the first few weeks of life in a special care unit for babies. Can you tell me about your experience?
I went for a scan at 33 weeks and I was not scanned again until 39 weeks. Basically, even though at the 33-week scan came back fine, I think my midwife should have listened to what I was saying. Should have sent me for another scan just to be on the safe side at, say, 35 weeks. It wouldn't have been too much trouble for them or myself to have attended. It seems to be a bizarre lottery. They shouldn't be. Just because you live in the West Midlands, you're less likely to have a stillbirth because of this, what the programme they do. They should be rolling it out into all hospitals.
Sadly, Alex's experience is not unique, and whilst expectant mothers in England and Wales continue to be subjected to the bizarre lottery that is antenatal care, things in the West Midlands are changing. These customised growth charts have led to a significant reduction of stillbirths in the West Midlands. So what we need to know now is how many lives have to be lost before they've begun for the NHS to roll out a standardised system of antenatal care throughout the UK.